In total, 65 cancer cases were identified in people under the age of 50 between January 2022 and December 25. The figures were provided by the GHA in response to GBC questions. They show a sharp rise in cases between 2022 and 2023, with the number of people diagnosed increasing from 3 to 21. However, the health authority says this is most likely down to improved data collection and reporting processes, particularly within dermatology services, rather than a real increase in cancer cases. The government says these figures should still be treated with caution because of the relatively small number of cases and the evolving nature of the database. Internationally, there's been growing concern over rising rates of bowel cancer in younger people. However, data locally suggests Gibraltar is not seeing a significant increase in this area. Early last year, the GHA said it was considering lowering the bowel cancer screening age to people over the age of 50 as opposed to 60, bringing Gibraltar in line with the UK. Specialist colorectal nurse Lindsay Rainford says this is something she is passionate about.
So sub-60, we do see cases of that, and not huge numbers, but enough to say that actually we should be doing something a bit more. And there are discussions being had. Our surgical team are really passionate about that as well. A lot of our colorectal surgery is done here in Gibraltar by our surgical team. We don't outsource a lot of those procedures or those operations to the UK, but the ones that we need to are the upper GI, the esophageal and gastric, and some of the other more complex cancers.
Lindsay says there have been 11 esophageal cancers diagnosed locally in the last 18 months, a figure she says is probably higher than they're used to seeing.
Sometimes if you've got people that might have moved here or not from here originally, those numbers might not represent the population. However, obviously the most important thing is that people symptoms, if they get symptoms of reflux, it's not settling down, indigestion, kind of taking lots of over-the-counter remedies. These are things that you want to see a GP as soon as possible for, so to make sure that you're not missing some of these signs, and you can get investigated and potentially treated with those. And the same with the bowel cancer screening and things like that. It's kind of as a background, bowel cancer screening really important to send those things off and be very aware of any symptoms.
Early diagnosis remains one of the most powerful tools in the fight against cancer.